FMIC's board and management are delighted to see so many of you from the country, from the region, and internationally, virtually, to have our partners from East Africa and elsewhere, Pakistan, and around Afghanistan, in regions in this country that are able to join us today, virtually, if not physically present. I may not be exactly the kind of chief guest speaker that you would expect at a conference like this, because I'm not a scientist, I'm not a clinician, but I do have credentials of having run university hospitals, as has been said, and running and teaching hospitals across the United States, in East Africa, in Pakistan, and being involved with you here in Afghanistan. I've had the privilege for the past 17 years to serve as chairman of the board of the French Medical Institute for Mothers and Children, or FMIC. That has given me a position to have the privilege of observing the accomplishments, the challenges, and all the things that all of you face in ensuring high quality of services, in conducting research, and delivering the highest quality of services all the ways you can in your institutions. I have learned that it's not easy, but my message to you today is it's not as hard as you think. I want to share some observations with you today that I will admit I'm trying to motivate. I want to challenge you a little bit to continue to pursue the thing that this conference represents today, and is well depicted by the incredible participation and membership that we have in the room. The Board of Trustees, the Board of FMIC and its management have set the goal for FMIC to attempt to serve as a model of excellence for other hospitals and healthcare institutions in the country, and wherever we can to serve as a catalyst for change. That is, to give you a platform like this where you can demonstrate your frontier work in doing research and carrying out change. That's what this symposium and this conference today is all about. This program does include presentations by a diverse group of people, the FMIC staff, faculty, residents, but also presentations from members of our community in Kabul and around the country. We will have presentations from them. There are tools that you can use to continue to educate yourselves on the required conditions and practices of high quality and high performing healthcare institutions. We use the term, and you've heard it today, evidence-based care, quality, research. I won't go into defining what evidence-based means today, but it's a term that you must know and a term that you must apply in your practice. And there are means within our own community here where we can exchange ideas to further our understanding of evidence-based quality and medicine and practice, because that should be the goal, to be able to demonstrate that we know what we're doing, to give us the tools to assess that we're doing what we wish to do at the highest level possible to do it. There are other tools that you have available to advance your knowledge and your performance in these areas. There are certifying and accrediting institutions by which the process of learning is important in your involvement with them, as is the final outcome of accreditation or certification. An example, for several years, FMIC has been certified and over recertified with the highest distinction by external auditors for ISO 9001 quality management systems. In fact, FMIC was the first hospital in Afghanistan to be ISO certified. However, ISO certification does not specifically address the opportunities and issues that we face in healthcare.
Here we come with the interesting part of my presentation, the results. And as you can see in this pie chart, This pie chart shows the gender-based distribution of our study. And we had 66% of boys and 34% of girls. Also, this bar chart shows the success rate between the cystoscopy and non-cystoscopy, or the technique as I mentioned. As you can see, we have 100% of success rate for cystoscopy, but we have 95% of success rate for non-cystoscopy, which is statistically no difference in the outcome. Also, this bar chart shows the average cost of cystoscopy and non-cystoscopy in Afghanis. And as you can see, we had 17,859 Afghanis in cystoscopy, but we had very low average of cost in non-cystoscopy. So we have 1,483 Afghanis in non-cystoscopy. As this graph clearly shows, the minimum length of stay at hospital. As you can see in cystoscopy, we had 8.29 hours stay at hospital. But in non-cystoscopy, we had half an hour stay at hospital.
Despite so many challenges in the country and other issues, but FMIC has continued to provide services as a normal since the beginning, and even in fact a lot of the services disturbed, but we continue to provide. The purpose of this is, we need to nurture the culture and the academic activities in Afghanistan. Each year we are holding two conferences, one on quality and other on the International Scientific Conference. And this conference is providing an opportunity, a platform for the researchers, the doctors, the nurses, the other healthcare providers to come forward and do their research and show their results. So this year we have over 128 studies, but 48 of them are going to be presented here, and the remaining are going to be the poster presentations outside. We have multiple papers. There's a lot of research is happening in Afghanistan. So this is Afghanistan and international both. So we have papers from Aga Khan University from Karachi, Aga Khan University from East Africa, Aga Khan Health Services in Afghanistan from Bamiyan, Faizabad, and the Kabul-based papers. So initially we were accepting as whatever it was coming, but now we have grown up. So we are taking real research papers in these, so which is creating an evidence, helping us in creating an evidence-based practices in Afghanistan. We are here not to just do whatever we can do at FMIC. We are here to support anyone and everyone, especially to Ministry of Public Health hospitals across Afghanistan. If you see, we have trained over 14,000 people in different disciplines for the Ministry of Public Health and WHO and the Aga Khan Health Services in Afghanistan. These doors are always open. We used to be on all the committees of the Ministry of Public Health for quality improvement, research, and the postgraduate medical education, nursing development, and midwifery. If you recall, we have been involved with Ghaznfar Institute of Health Sciences since 2002 of helping nursing curricular development and execution of training of the teachers. And now we are working with the Afghanistan Nursing and Midwifery Councils. We are also working with Ministry of Public Health to improve the health system. So we are currently, we have been given Ataturk Hospital to support and improve the health services, and Ataturk Hospital together with Aga Khan Health Services, you can go and witness what changes we have tried to bring in the, we have not asked for any additional money. Whatever the money was being given, we have made changes, and these doors are always open. Unfortunately, since last 1 year, a lot of the brain drain has happened. We have also witnessed around 77 doctors have left from us. But alhamdulillah, shukr alhamdulillah, we had the postgraduate medical education. So we were producing consultants, so it has remained. Our future plan is, yesterday our board has a long full day retreat in discussing how we can do for the future. We are now going towards the subspecialties, right? For example, we were training earlier just a simple cardiologist. Now we want to subspecialty in the cardiology. There are rhythms. For the rhythms, we want to have the special doctors for interventional cardiology. For interventional cardiology for adults and children separately. Likewise, we want to start the neurosciences, neurology postgraduate medical education. We want to start the urology, infectious diseases, and ICU, NICU. These are not available in Afghanistan. And inshallah, yesterday we had a long full day discussion that how, but these trainings will take us minimum 4 years. If we start today, it will take us 4 years. So it's a long way, but inshallah we are on the way that we will continue to train more health. Not only just doctors, but the most important thing is the nursing and allied health. We need nurses who are experts in NICU, who are experts in ICU, who are experts in operating room, who are expert in the cath room. So we have discussed with the board yesterday. Gradually we will start. For the nursing diploma courses, we will start inshallah in the subspecialties where they can become the leaders of their particular area.
در واقع خود ریسرچ هدف اصلیش هم همی است که هم کمک بکنه برای بلند بردن سطح علمی در تمام سطح کشور و تمام دنیا و هم دیگه ای که کارهای تحقیقی برای مردم هم زیاد کمک میکنه. قسمی که شما شاهد بودین ریسرچی که من انجام دادم زیادتر هم برای تحقیق علمی ما افزوده شد در کارهای اکادمیک ما و هم دیگه برای مردم ارزش بسیار زیاد و به سزای خود داشت که مثلا ما با یک تکنیک بسیار ساده میتونیم یک پروسیجر جراحی را در هر سطح کلینیکا و در شفاخانه‌هایی که در ولایات هم هستن، شفاخانه‌های دولتی، اونا هم میتونن تطبیق بکنن.
د عامه روغتیا وزارت خو د پرایویټ سېکټر سره وخت په وخت باندې د همکارۍ لپاره ناستې هم ترسره کړې دي. دا چې دلته تاسو د کوم کنفرانس شاهدان استئ دا هم د عامه روغتیا وزارت د پرایویټ سېکټر سره یا دلته په افغانستان کې تحقیقاتو لپاره د ودې ورکولو لپاره او دلته د دوی د همکارۍ لپاره زمونږ یو ښه نمونه ده چې دلته تاسو د کنفرانس شاهدان استئ. د عامه روغتیا وزارت بیا هم یادونه باید ورڅخه وکوم د هغه ټول اداراتو چې په افغانستان کې کار کوي دلته کې تحقیقات په برخه کې دي یا د روغتي خدمات په برخه کې دي دغه د هڅو قدرداني کوي. په اوسني دور کې طبابت چې دا د تحقیقاتو په اساس باندې ده څومره چې ریسرچونه شوي دي دلته کومې مقالې پریزنټ کیږي دا زمونږ د روغتي سکتور کې دلته د خدماتو په معیاري کولو باندې اساسي رول لري. کله چې یو څه باندې څېړنه کیږي تحقیق کیږي نو د هغې نتیجه وروسته د آینده روغتي پرسنل لپاره او دلته د روغتي خدماتو د وړاندې کولو لپاره ډېر مؤثر رول لري.
و برگزاری این گونه برنامه ها برای بلند بردن سطح ارتقای ظرفیت تمام دکتر صاحبان بسیار مفید تمام میشه و همچنین از وزارت صحت عامه درخواست ما همی است البته از تمام دکتر صاحبا که باید این گونه برنامه ها را زیادتر بسازه و زمینه را بر خودمون مساعد بسازه تا ما بتونیم که سطح ظرفیت ارتقای ظرفیت خود بلند ببریم.
آژانس خبری پژواک انعکاس دهنده حقایق